1. Which antibody is responsible for A. False positive Virtel test? A. Anti-SSA, B. Anti-DSA, C. Anticardiolipin, D. Antihistin.
Answer: C. Anticardiolipin. Explanation: anticardiolipin is one of the antiphospholipid antibodies that can cause false positive VDR-LRPR tests. 2. Lupus anticoagulant causes which lab abnormality? A. PTT, beep, PTTC, platelets, D, DEM-BC. Answer: BPTT. Explanation: lupus anticoagulant falsely elevates the PTT without a bleeding tendency. 3. Antiphospholipid antibody syndrome is characterized by which condition? A. Hypercoagulable state, B. Hypercoagulable state, C. Pancytopenia, D. Hypersensitivity reaction. Answer: B. Hypercoagulable state. Explanation: it causes arterial and venous thromboses. 4. Which of the following is associated with recurrent pregnancy loss? A. Anti-histin antibody, B. Antiphospholipid antibody syndrome, C. Sjögren syndrome, D. Systemic sclerosis. Answer: B. Antiphospholipid antibody syndrome. Explanation: thrombosis of placental vessels causes recurrent miscarriage. 5. Antihistone antibody is most commonly seen in which condition? A. Drug-induced lupus, B. Rheumatoid arthritis, C. Sjögren syndrome, D. Scleroderma. Answer: a drug-induced lupus.
Explanation: antihistin antibody is characteristic of drug-induced lupus. 6. Which drug does not typically cause drug-induced lupus? A. Hydralazine, B. isoniazid, C. procainamide, D. aspirin.
Answer: D. aspirin. Explanation: aspirin is not associated with drug-induced lupus. 7. Which test is positive by definition in lupus? A. RFB, ANAC, antihistin, D. anti-SSA. Answer: BANA. Explanation: ANA, antinuclear antibody, is positive by definition in lupus. 8. What is the first-line treatment for lupus? Flares? A. Anticoagulants, B. Antibiotics, C. Glucocorticoids, D. EVIG. Answer: C. Glucocorticoids.
Explanation: steroids are used for acute flares of SLE. 9. Which of the following symptoms is classically seen in Sjögren syndrome? A. Weight gain, B. xerostomia and dry eyes, C. hematuria, D. rash.
Answer: B. xerostomia and dry eyes. Explanation: dry mouth and dry eyes are hallmark features. 10. Which antibody is associated with neonatal lupus and congenital heart block? A. Anti-dsDNA, B. anti-SSA Rho, C. Anti-centromere, D. ANA. Answer: B. anti-SSA Rho. Explanation: these cross the placenta and cause neonatal lupus. 11. Which finding supports the diagnosis of Sjögren syndrome? A. lip biopsy showing lymphocytic sialadenitis. B. Anti-centromere. Antibody. C. Low complement levels. D. Positive RPR. Answer: a lip biopsy showing lymphocytic sialadenitis. Explanation: it confirms glandular inflammation. 12. What is a feared complication of long-standing Sjögren syndrome? A. Pancreatitis. B. Renal failure. C. B-cell lymphoma. D. Pulmonary embolism. Answer: C. B-cell lymphoma. Explanation: especially marginal zone lymphoma presents with unilateral parotid enlargement. 13. Systemic sclerosis is characterized by deposition of which substance? A. Amyloid. B. Collagen. C. Keratin. D. Fibrin. Answer: B. Collagen. Explanation: fibroblast activation leads to excessive collagen deposition in skin and organs. 14. Which of the following is characteristic of limited systemic sclerosis? A. Early visceral involvement. B. Widespread skin fibrosis. C. CREST syndrome. D. Anti-dsDNA antibodies. Answer: C. CREST syndrome. Explanation: limited systemic sclerosis is the prototype of CREST syndrome. 15. What does the C in CREST syndrome stand for? A. Collagen B calcinosis. C. Cirrhosis. D. Creatinine. Answer: B. Calcinosis. Explanation: C equals calcinosis in CREST. Calcinosis, Raynaud, esophageal dysmotility, sclerodactyly, telangiectasia. 16. Which antibody is commonly associated with limited systemic sclerosis? A. Anti-dsDNA. B. Anti-RNPC. Anti-centromere. D. Anti-histamine. Answer: C. Anti-centromere. Explanation: CREST syndrome is highly associated with anti-centromere antibodies. 17. Which form of systemic sclerosis is associated with early visceral involvement? A. Diffuse type. B. Limited type. C. CREST syndrome. D. Drug-induced lupus. Answer: a diffuse type. Explanation: diffuse type has widespread skin involvement and early visceral involvement. 18. Anti-SCL70 antibody is directed against which enzyme? A. DNA polymerase. B. topoisomerase I. C. RNA polymerase. D. helicase. Answer: B. topoisomerase I. Explanation: anti-CCL70 targets DNA topoisomerase I and is associated with diffuse systemic sclerosis. 19. Which of the following is commonly involved in diffuse systemic sclerosis? A. Retina. B. GI tract. C. Pituitary. D. Spleen. Answer: B. GI tract. Explanation: esophageal dysmotility and reflux are common GI findings. 20. Mixed connective tissue disease is associated with antibodies to which molecule? Anti-D, Ant B, anti-D, anti-SM, C, anti-U1RNP, D, anti-Rho. Answer: C, anti-U1RNP. Explanation: MCTD is characterized by anti-U1 ribonucleoprine antibodies. 21. Mixed connective tissue disease has features of all except A, systemic sclerosis, B, SLE, C, rheumatic fever, D, polymyositis. Answer: C, rheumatic fever. Explanation: MCTD overlaps with SLE, systemic sclerosis, and polymyositis.
22. What is the first step of wound healing? A, fibrosis, B, collagen deposition, C, inflammation, D, granulation tissue formation. Answer: C, inflammation. Explanation: healing is initiated when inflammation begins. 23. Which type of tissue has the highest regenerative capacity? A, stable tissue, B, permanent tissue, C, labile tissue, D, connective tissue. Answer: C, labile tissue. Explanation: labile tissues continuously divide and regenerate, like skin and GI epithelium. 24. Stem cells in the small intestine are located in which part? A, villi, B, serosa, C, mucosal crypts, D, submucosa. Answer: C, mucosal crypts. Explanation: the intestinal stem cells reside in the crypts of Lieberg-HN. 25. Which organ regenerates via compensatory hyperplasia after partial resection? Brain, B, liver, C, heart, D, lung. Answer: B, liver. Explanation: liver has stable cells that can re-enter the cell cycle to regenerate. Thank you for watching.